day of my pulmonologist appointment finally arrives. I get checked in and begin filling out my paperwork. I am checking these boxes for my symptoms: chest pain, shortness of breath, dizziness, fatigue, confusion. I know I am here for a reason. I have done everything I could before here. 16 medical tests, 2 medications, 2 doctors, 2 trips to the ER, and countless hours of sitting out of activities I love. There was nothing more I could do. This was where I needed to be. I want to talk about waiting for a minute. Waiting for the doctor can be irritating, can't it? I mean, first you wait in the waiting room for what feels like an eternity, and then finally the nurse says, "The doctor will see you now." Only the doctor will not see you now. The doctor will not see you now for another 45 minutes. And so you sit there on your paper-covered examination table in your crunchy paper dress, feeling like a giant piece of origami, and you wait. Sometimes you might weigh yourself, or steal a moist towelette or two, or even spin around in a little spinny chair. Or other times, sometimes you just wait. Women are constantly being mistreated in healthcare. I know this firsthand, as it took over 4 years to get a diagnosis on a back injury of mine. I was constantly dismissed for being young and dramatic. According to Healthline.com, 1 in 5 women feel like they have been ignored or mistreated by healthcare professionals. In this program, we will take a look at the extreme dangers that this gender discrimination in healthcare can cause, featuring the pieces "Blonde Girl in a Pulmonologist's Office" by an unknown author, "I Got Sick, Then I Got Better" by Jenny Allen, and "Exploring Gender Bias in Healthcare," an article from FierceHealthline.com, a program, because they just won't take me seriously. Heart attack is the leading killer of American women. Since 1984, the mortality rate of heart attacks has been greater for women than men. Studies show that there is no physical reason for this difference. In fact, a study in the Journal of the American Heart Association found that when women receive the same treatments as men, their odds of survival are the same. Therefore, it is safe to assume that the increased danger for women lies in the response of their heart attacks, not in the heart attacks themselves. The pulmonologist comes in, and I can tell with one look at me he isn't going to believe me. Less than a minute later, his words back up that claim. He says, "Well, your pulmonary function test shows you have asthma." Now, I'm no expert, but it seems like somewhere in the 16 medical tests, somebody would have thought of that. But as I sit in this office, answering the same questions I have been asked over and over again, I know I can't say anything. Because I don't have a degree in pulmonology, and well, most importantly, I'm a young blonde girl in a doctor's office, and that alone is enough to discredit me. It all started 6 years ago when I started having these abdominal pains. They weren't crippling, but after a few months of this, I went to a gynecologist. He could not have been less concerned. He did a pap smear and ordered a sonogram. The results: no findings of a concerning nature. 6 months went by, and I still had this mysterious pain, so I went to my regular doctor, Dr. Scavini. He felt around and said, "Why don't you go to a colonoscopy?" The colonoscopy doctor didn't know either, but I did get to have my first colonoscopy, so that was a treat. After playing 20 questions with the doctor, he draws the final conclusion of, "Yeah, you have asthma," and prescribed me 2 inhalers, one to take once a day, every day, and one to take during shortness of breath. I sit there biting my tongue, trying not to cry, because I know in my heart this man is dead wrong. I know what I have cannot just be asthma, but I know I can't say a word because I haven't jumped through this hoop yet. I'm mad at him, I am mad at the medical system, and I'm a little mad at myself for not thinking about this hoop before coming here. How could I be so stupid? How could I forget the obvious thing of asthma? Now I've wasted this appointment with the one person who should be the most helpful, the one that should have been able to find the actual issue, but no, I'm supposed to wait 3 months before coming back to tell him, "Hey, this wasn't right," and then see what other shit he can come up with before he'll take me seriously? What can I do to make him take me seriously? Pain management is yet another area where women are not taken as seriously as they should by some medical professionals. Treatment of pain differs greatly between genders. Even though women comprise most of the diagnosis of chronic pain, many females feel that their pain was not initially taken seriously. 9 months went by and my pain had returned, so I went back to my gynecologist for a checkup. This time, he called a few days later and said he had some concerning news. A follow-up biopsy showed that I had endometrial cancer, which is a cancer of the lining of the uterus. I called Dr. Scavini to tell him the news. I left him a message that I had something important to tell him. He never called me back. I opened the packaging for these inhalers, and there it is. Thousands and thousands of microscopic little words on very large pieces of paper. Every side effect, every bad reaction I may have, every possible trial they have ever done with these. I try to read it all, but it is literally impossible. The sheer amount of words is overwhelming. I skim the papers, picking up the highlights. Don't take more than one dose at a time. If your symptoms get worse, stop right away. You will probably experience these side effects, blah, blah, blah. Mental illness is also a discipline where gender bias is becoming more apparent. According to the World Health Organization, overall rates of psychiatric disorder are almost identical for men and women, but striking gender differences are found in the patterns of mental illness. It is important to make sure that women are not overtreated for mental health disorders because their other health complaints are not taken seriously. The only way to treat endometrial cancer is to give you a complete hysterectomy as soon as possible. The day after my surgery, Dr. G entered my hospital room. He told me that they had found a malignancy on my right ovary, and that it would take 5 to 7 days for the lab to determine if I had 2 types of cancer or just the one. 5 days later, I hadn't heard anything. 7 days later, I called the office and was told Dr. G was in Florida. 2 weeks later, still no word. 19 days later, I was called by a sullen young doctor who told me that he couldn't answer any of my questions, but the results showed that I had 2 types of cancer, ovarian along with endometrial. I tried to fold the papers to put them back in the boxes, but I can't. It's impossible. It is at that moment when I give up. I throw the papers to the ground along with the boxes and anything else that just happened to be at my bed at the time. I start crying. I am done going to doctors who don't believe me. I am done going to doctors who care more about profit than actually helping people. I am done jumping through hoop after hoop because you don't want to believe a young woman. I am done paying for things I know won't do anything. I am just done. But it's too late. I don't get to be done. I had my chance to say something, but since I was done arguing, I lost it. All I can do now is hope that in 3 months, maybe they will listen. But then again, I will be right back where I started, a blonde girl in a pulmonologist's office. A few areas of possible improvements emerge when considering gender bias. 1, recognizing gender bias. The first step is to acknowledge that gender bias actually exists. 2, conducting more research involving women. Many research studies into diseases and treatments are skewed with a higher number of male participants. 3, educating healthcare professionals. Outreach programs to help healthcare organizations address the gender bias will help make professionals more aware of bias and how it manifests. It is also important that medical teams understand how certain health issues can present differently in men and women. A month later, I'm supposed to pay $400 again for this inhaler that has only made things worse. I call the pulmonologist and tell him it's not working. His next suggestion was that maybe I had anxiety. I inform him that yes, I do, that I've had it for 7 years and I've never had these symptoms before. He then informs me that he has no idea and that he's sorry he can't help me more. He cancels my 3-month appointment and says good luck. It's gradually sunk in that what had happened to me, seemingly fine one day and terribly sick the next, is really like being in a violent car accident. Except this accident is still happening. I don't say this to the oncologist, but in my head I'm reciting my rosary beads of resentment. If I hadn't gotten so sick, I wouldn't have had to have chemo, I wouldn't have my hair falling out in clumps in the shower, and I wouldn't have to learn that losing my hair is nothing compared to the other side effects of chemo. But most of all, I wouldn't have to keep thinking that all of this could have been avoided if they would have just listened to me. If they would have just taken my pain seriously in the first place, maybe then none of this would have ever happened.